Raelia Lew is a profoundly credentialed fertility specialist, gynaecologist and obstetrician. She is founder of Women's Health Melbourne, a leading fertility clinic, and is co-founder of new evidence-based women's sexual health product, Lovers. Welcome to Pure Health Hub, Raelia.
Thank you so much for having me.
Oh, it's a pleasure. We're thrilled to have you. Now, when we locked in our chat, I was interested in, of course, your deep knowledge and experience in gynecology and fertility. But then I started to research you and discovered a product, Lovers. So in the interest of all pre, during and postmenopausal women continuing fulfilling sex lives, or indeed would like to, we're going to have to learn more. But we'll get to that later. So given all women have differing experiences of menopause, I called on my tribe to share theirs, including that of intimacy as they approach the end of menopause and certainly post-menopause. So my questions are a reflection of this. Now, many women said the greatest loss is the intimacy they once shared with their partner, and they would do anything to get it back. So what's happening with our libido when our libido vanishes, and can and does it return?
I actually challenge that our libido vanishes, but our bodies do change, and our relationship with sexuality changes. Sometimes what occurs is the physical effects of having a persistent low hormonal level, which is what occurs in our transition from perimenopause to menopause, is the vagina and vulva and clitoris become more sensitive and become less protected by the natural hormonal kind of benefits of having estrogen around. And what that means is that this very delicate skin can become friable. It can cause little micro abrasions and fissures when we have penetrative sex. And it kind of starts this bit of a vicious spiral of anticipated pain and discomfort, which then turns us off the idea of having sex. So what we can do is, kind of look and explore. So what can we do to help women feel comfortable and satisfied? And that is kind of linked to our drive and libido as much as hormones are, because women are complicated creatures. Sex is always, at any age, very cerebral for us. It's not just physical. And so making sure that we don't have that vicious spiral of discomfort leading to apprehension, leading to kind of, I suppose, reduced desire is also part of that picture.
Yeah, that makes perfect sense, actually, because, if it does get really uncomfortable, then of course you're going to pull away. So when you talk about that it doesn't, actually, we'll go on, because there are a number of reasons then, is what you're saying about the reason for a decrease in libido sometimes.
That's right. There's physical reasons too. So from a hormonal perspective, estrogen is one of the key hormones made by our ovaries, and we're used to having this baseline estrogen level. I often talk about hot flushes in this way as well, in that, adolescent, kind of women start to make estrogen. When we are children, we actually have estrogen levels that are parallel to what are experienced in menopause. So why don't little girls have hot flashes? So it's not the lack of estrogen that causes that. It's being almost in estrogen withdrawal. It's like we get addicted to estrogen, like people get addicted to heroin. If you never have heroin, you're not going to have withdrawal. But if you're used to it and you take it away, then you get this really serious set of symptoms that are akin to being in withdrawal. And that's
why we're grumpy too, right?
Often, yes. Well, it's complicated, because when we have, these symptoms, often it's associated also with things like, modulating our mood, things like sleep disturbance, which can make anybody less tolerant to any challenges that we face. And so there's layers on layers when we talk about menopause. It's not a simple thing that a tablet will fix. It's complicated, and we need a holistic perspective.
Yeah, exactly, which is why we need to be talking about it so much more. Okay, so then what are some, what can we do to increase the libido or increase the libido? I was going to say desire something, but what can we be doing and taking it part of that holistic approach?
Yeah, so I think, we need to separate the mind and body and, honor both. From a point of view of the physical, having estrogen reintroduced to our system in different ways can help, because estrogen is, nature's original aphrodisiac. When we ovulate and release an egg, nature intends that us, for us to go out and try and get pregnant. And so the estrogen hormone surge actually makes us sexually interested and, increases our propensity to seek sexual activity and, kind of helps us lubricate and helps us, find desire. So estrogen is an important hormone. Testosterone is also an important hormone, and it's often misnamed a male hormone, whereas actually it's very important for women also. So our ovaries are also the creators of testosterone for women. So sometimes testosterone replacement can help with women who have blunted libido. But then the other side of the equation is, the mind, and thinking about sexuality more as a kind of whole body experience and a mindful experience. Our greatest erogenous zone as women is our skin. Just have to think about, how satisfying it is to go for a massage. Thinking about, kind of penis vagina sex as the only definition of sex is very limiting, and exploring sexuality beyond that can be very satisfying at any age, but particularly around perimenopause and menopause.
Yeah. And, one thing leads to another, obviously. So it's about just making sure that we don't have these expectations of the, of that end result. So, good point. All right. So then women's sexuality, self-pleasure and joy in sexual activity and intimacy has long been almost a taboo public discussion. And I think in some ways it still is. Yet sex, and great sex and resulting in orgasms, is extremely good for our health. What does it do? What are the physical and psychological health benefits of sex and orgasm?
Release endorphins, which is, nature's kind of happy drugs. When we have an orgasm, we release oxytocin, which is the love chemical, and we have this sense of deep relaxation having experienced orgasm. It can help us sleep, and it can help us de-stress. So there are definite physical benefits of having an orgasm. In terms of our kind of other reactions to sex, it also often, for some, it's very different. We all have a different definition of what satisfying sex is, but for many it might also be closeness and intimacy and relationships and, a way of expressing affection. So there are again multi-layered levels of how sex is perceived and benefits women.
Yeah, exactly. And we obviously all get much out of it as part of that whole relationship, right? The holistic relationship. Well, as you get to a certain age, there's this term that pops up, and it's vaginal atrophy, which is a bloody awful term. What is it exactly? And what can we do to minimize, avoid it, or turn it around?
Vaginal atrophy or vulvovaginal atrophy, also clitoral atrophy, is basically what happens to the tissues of the female genital tract in the absence of estrogen. The tissues become more friable and delicate. The actual size of the tissues reduces. And in terms of having, kind of glandular, at a level of just like looking under a microscope at the glands are drier and they're less plump and less protected. So this is a response to withdrawal of the hormone estrogen.
Yeah, so is it also, for me, I think when I first heard it some time back, it was like, I assumed it was like, well, it's, you're not having sex anymore. So has it got to do with not having, like, not functioning properly, or as you said, it's also the hormonal thing as well?
Well, look, there is a bit of both in that. In response to sex, the vagina dilates, and there is a little bit of use it or lose it in terms of sexuality, and it's hard to allow atrophy to get to the point where there's a significant physical barrier to sex and then get it back. You can get it back.
It sounds like that, though, right?
Yeah, you can get it back. It can be done, and when you think about it, you can create a neo vagina. For patients from nothing. So you can get a vagina functioning again if you feel that you've really kind of lost the ability to have penetrative sex that you once did. It's an effort. It can involve estrogen therapy. A lot of people may have kind of a nervousness in approaching hormone replacement therapy or menopausal hormonal therapies, but for many women, that is actually a really good solution. And adding back some estrogen locally can help. And then also having some, kind of building a team of professionals to help you as well. Sexual counselling, physiotherapy, can often use what's called dilator therapy, using wands to gently stretch the vagina so that ultimately over time we can achieve more comfortable dilatation. So there are solutions that are there. But, I think the best thing is for us to be aware that there are genital changes that happen with menopause. What can we do to prevent them from occurring in the first place?
Yeah, right. But there are varying levels of this vaginal atrophy, right? So
that's right.
When we talk about that, it doesn't mean that you can't have sex again. It's just different levels of where you're at. But you obviously, is that sort of that extent and that extreme common to have to go through all of those?
Well, what it is very common, but there are lots of people who just hang up their kind of sexual apron if that happens.
Right. Yeah, because I would imagine it'd be extremely intimidating for women. Yeah. Wow, it's extraordinary, isn't it? And something that we sadly don't talk about enough, which is why I was so keen to get this out there. So, look, for centuries, the only information that we've been getting as menopausal women have been, accessed via the village wire. So in other words, our female tribe. So the notions and potions, rarely evidence-based, but usually feature a natural wellness wisdom that has been tried and tested, but then ditched in the next generation. So I think we're quite fortunate in this generation to have access to products and knowledge and things like that, even if we do have to really go searching for this information. Now, which is why I was fascinated by this product that you've produced, Lovers. But can you tell me about Lovers, and can you tell me about Lovers and what does the range consist of?
Lovers was my brainchild when I was working, particularly as a fertility subspecialist, which is my main area of practice. One of the groups of women I help are women with cancer who have fertility preservation and who then I look after during cancer treatment and late effects. And when I was looking after women in this situation who could not really access hormonal therapies, most of the women, in terms of breast cancer being very common, and sometimes that's a hormone related cancer where estrogen is not okay. There are a lot of sexual effects, a lot of that vulvovaginal atrophy type spectrum, even in young women in their 30s and 40s, because we've artificially taken their hormones away.
Yeah.
And there's a lot of sexual discomfort, and lube goes in that group of women, as it does for women in menopause, from a maybe to a must if you want to have sexual comfort.
Yeah.
A lot of women grow up not using lube or remembering it as, service station green tube lube that's awful and sticky and gross. Well, I actually, and look, I actually, researched every lube that was available clinically and came up very dissatisfied with what the quality of product was on the spectrum from medical to pharmacy and over the counter of what was available for women. And so, it occurred to me that, women, are into products. We're very, kind of cautious and we research what we put on our face, what we put on our bodies, and we're using this rubbish on our vulva and our vagina.
Yeah.
And so I thought, well, why can't we make lube beautiful? Why can't we make lube high quality like we would high-end skincare? Because it's an important part of our body that deserves respect and care. And so I developed Lovers initially for those patients working with a compounding pharmacy at the time on a very small scale to help those individual patients have a better solution. And it occurred to me, as a fertility doctor, I actually use vaginal medications all the time. I prescribe progesterone to support pregnancies in an IVF context that we use vaginally. In my days, I call myself a retired obstetrician now because in my fertility practice, I make far too many babies to actually deliver them personally. But, when we induce labour, we give medicines vaginally because it's a really great way to get medicines into the body quickly and get a fast effect. Unlike oral medications, they don't have to go through your first pass hepatic, which is the liver system, or your gastrointestinal tract to ultimately get where they're going. They immediately affect the target organ, which is the vagina, vulva, and clitoris. So it occurred to me that we can give women molecules in lube that promote sexual satisfaction. And so I invented different lubricant formulations. What they have in common is they have beautiful, cosmetically elegant bases with the choice of either aqueous or silicone serum that feel luxurious and lovely, not sticky and yucky, and that work really well for the function of a lubricant. But then we've also enhanced the formulations with ingredients that are nourishing, with ingredients that are promoting skin health, and also active molecules that can improve women's experience of sex. So one of my lubricant formulations is estrogen enhanced, which is wonderful for women who are estrogen deprived. It gives that hit of estrogen that acts as an aphrodisiac. Equally useful for women who are in perimenopause and menopause, but also women who are in other low estrogen states, like, for example, breastfeeding mothers.
Right.
We also have a lubricant formulation from Lovers that is aimed to improve genital sensitivity and blood flow and improve libido. So for that, we use a female form of Viagra, and we also use testosterone and some vasodilators. So when you apply our formulation with those active molecules, it draws blood to the area and makes the area more sensitive. I have another formulation.
Topical, right?
Yeah, it's topical. Yeah. It's all topical, exactly. Yeah. We have another formulation that has cannabidiol, which is a cannabis-derived molecule in purified form. We say cannabidiol gives the chill without the high. Yeah. What that means is that if women who have difficulty achieving orgasm, they just can't get there, or women who have other sexual concerns related to vaginismus or endometriosis or sexual pain, it's really helpful to break that cycle of anticipated discomfort and help women relax into their orgasm. Wow. And we also have other varieties that are specifically designed to be fertility friendly and to be skin nourishing for women who have different challenges in those kind of areas that they kind of want to kind of take into their plan of sexuality. And, with Lovers, it's not like there's one variety that is for one person. A different person, like, people can try different varieties in different stages and in different phases of life, but also in just different moods.
Right.
So that's right. Lovers.
Wow, it's extraordinary. And finally, somebody who understands what's going. I mean, as you say, those products that were on the supermarket shelves, they can't be good. The ingredients list must be, fairly, well, not great for women, let's put it that way. But I noticed in one of the ingredients, and I didn't study too closely, but I noticed one of the ingredients is the old wives' borax. What is important?
Boric acid. So it's not an old wives' tale at all. It's a proven preventer for thrush. So thrush is caused by Candida albicans. So Candida albicans and other Candida species, they're not bad guys, but when they get out of control and throw a party in the vagina, they can upset the floral balance. And there are a lot of women who get recurrent thrush that they can't get rid of, and they've tried antifungal drugs, either topically or orally, many times. Boric acid works to really halt thrush in its tracks in a different way. It stops the fungal hyphae. It is a yeast or a fungus. It stops the fungal hyphae, which are the little kind of spores, from developing. And so it basically kind of deactivates the Candida and stops it from growing. And what that means is the other good bacteria have a chance to thrive. So our formulation with boric acid, Real Love, is a non-prescription varietal, and it has probiotic ingredients to encourage good bacteria, and it has fungostatic ingredients to stop the thrush. And so women who get thrush after sex or around their cycle can use our Lovers formulations as a treatment, actually, daily. Some of our formulations are designed with a beautiful barrier function and a beautiful skin nourishing function. So as well as being lube, they're actually skincare for your vulva.
Wow. Wow. This is more extraordinary than I even thought. So, and I did notice that some things are on prescription. And so what is the difference there?
So some of our active formulations have very powerful molecules like cannabidiol, for example, that are prescription only. Our hormonally enhanced formulations are prescription only. What that means is that when you go on the Lovers website and order a prescription product, you're asked to fill in a detailed questionnaire about your own health, and that is analysed by a doctor before issuing your prescription. And if for whatever reason there's something in your medical history that means that a product shouldn't be for you, or maybe a product might be better for you, then we would generally give that advice before issuing a prescription product.
Right. So that can be done like in a telehealth kind of arrangement.
It's all online.
Wow, that's fantastic. I am absolutely, I mean, I could talk to you for days, and I hope that you'll come back. But I think, this product really is next level, and something that that women from a much younger age than the 50s could benefit from. What a wonderful reason to create it, but what an audience you will have with it. So I'm going to have to try some. Listen, thank you. I want to thank you for your time this morning. It's been a treat and enlightening, particularly about, so many things, but I love the borax. We were told once that you had to use yogurt for thrush, and there's something like borax or boric acid. So, again, we go back to the village, right? But what a wonderful, wonderful product, and wish you all the best with it. We will put the links on our site to the product, because I'm absolutely thrilled that finally someone's brought something out for us. Raelia, thank you so much for your time. I appreciate it.
Oh, thank you so much.